Diabetes treatment. Diabetes self-care at home. If a person has diabetes, healthful lifestyle choices in diet, exercise, and other health habits will help to improve glycemic control and prevent or minimize complications of diabetes. Diabetes diet. A healthy diet is key to controlling blood sugar levels and preventing diabetes complications. If the patient is obese and has had difficulty losing weight on their own, talk to a healthcare professional. He or she can recommend a dietitian or a weight modification program to help the patient reach a goal. Eat a consistent, well balanced diet that is high in fiber, low in saturated fat, and low in concentrated sweets. A consistent diet that includes roughly the same number of calories at about the same times of day helps the healthcare professional prescribe the correct dose of medication or insulin. A healthy diet also helps to keep blood sugar at a relatively even level and avoids excessively low or high blood sugar levels, which can be dangerous and even life threatening. Exercise. Regular exercise in any form can help reduce the risk of developing diabetes. Activity can also reduce the risk of developing complications of diabetes such as heart disease, stroke, kidney failure, blindness, and leg ulcers. As little as 20 minutes of walking 3 times a week has proven beneficial effect. Any exercise is beneficial, no matter how easy or how long. Some exercise is better than no exercise. If the patient has complications of diabetes, such as eye, kidney, or nerve problems, they may be limited both in type of exercise and amount of exercise they can safely do without worsening their condition. Consult with your healthcare professional before starting any exercise program. Alcohol use. Moderate or eliminate consumption of alcohol. Try to have no more than 7 alcoholic drinks in a week and never more than 1 or 2 drinks in an evening. One drink is considered 1.5 ounces of liquor, 6 ounces of wine, or 12 ounces of beer. Excessive alcohol use is known risk factor for type 2 diabetes. Alcohol consumption can cause low or high blood sugar levels, nerve pain, and an increase in triglycerides. Smoking. If the patient has diabetes and smokes cigarettes or use any other form of tobacco, they are raising the risks markedly for nearly all of the complications of diabetes. Smoking damages blood vessels and contributes to heart disease, stroke, and poor circulation in the limbs. If a person needs help to quit tobacco use, talk to a healthcare professional. Self-monitored blood glucose. Check blood sugar levels frequently, at least before meals and at bedtime. Then record the results in a logbook. Better equipment now available makes testing blood sugar levels less painful and less complicated than ever. A daily blood sugar diary is invaluable to the healthcare professional in evaluating how the patient is responding to medications, diet, and exercise in the treatment of diabetes. Medicare now pays for diabetic testing supplies, as do many private insurers and Medicaid. Diabetics medical treatment. The treatment of diabetes is highly individualized, depending on the type of diabetes, whether the patient has other active medical problems, whether the patient has complications of diabetes, and age and general health of the patient at the time of diagnosis. A healthcare professional will set goals for lifestyle changes, blood sugar control, and treatment. Together, the patient and the healthcare professional will formulate a plan to help meet those goals. Education about diabetes and its treatment is essential in all types of diabetes. When the patient is first diagnosed with diabetes, the diabetes care team will spend a lot of time with the patient. The diabetes care team includes the healthcare professional and his or her staff. It may include specialists in foot care, neurology, kidney diseases, and eye diseases. A professional dietitian and a diabetes educator also may be a part of the team. The healthcare team will see the patient at appropriate intervals to monitor their progress and evaluate goals. Type 1 diabetes. Treatment of diabetes almost always involves the daily injection of insulin, usually a combination of short-acting insulin, for example, Lispro or Espat, and a longer-acting insulin, for example, NPH, Lente, Glargine. Insulin must be given as an injection just under the skin. If taken by mouth, insulin would be destroyed in the stomach before it could get into the blood where it is needed. Most people with type 1 diabetes give these injections to themselves. Even if someone else usually gives the patient injections, it is important that the patient knows how to do it in case the other person isn't available. A trained professional will show the patient how to score and inject the insulin. Usually, this is a nurse who works with the healthcare professional or a diabetes educator. Insulin is usually given in 2 or 3 injections per day, generally around meals time. Dosage is individualized and is tailored to the patient's specific needs by the healthcare professional. Longer acting insulins are typically administered 1 or 2 times per day. Some people have their insulin administered by continuous infusion pumps to provide adequate blood glucose control. Supplemental mealtime insulin is programmed into the pump by the individual as recommended by his or healthcare professionals. It is very important to eat after the taking insulin, as the insulin will lower blood sugars regardless of whether the person has eaten. If insulin is taken without eating, the result may be hypoglycemia. This is called an insulin reaction. There is an adjustment period while the patient learns how insulin affects them and how to time meals and exercise with insulin injections to keep blood sugar levels as even as possible. Keeping accurate records of blood sugar levels and insulin dosages is crucial for the patient's diabetes management. Eating a consistent, healthy diet appropriate for the patient's size and weight is essential in controlling blood sugar level. Depending on how elevated the patient's blood sugar and glycosylated hemoglobin are at the time of diagnosis, they may be given a chance to lower blood sugar levels through lifestyle changes without medication. The best way to do this is to lose weight if the patient is obese and begin an exercise program. If they remain high, the patient will be started on an oral medication, usually a sulfonylurea or biguanide, to help control blood sugar levels. Even if the patient is on medication, it is still important to eat a healthy diet, lose weight if they are overweight, and engage in moderate physical activity as often as possible. The healthcare professional will initially monitor the patient's progress on medication very carefully. It is important to receive just the right dose of the right medication to regulate the blood sugar levels in the recommended range with the fewest side effects. The doctor may decide to combine 2 types of medications to achieve blood sugar levels control. Gradually, even people with type 2 diabetes may require insulin injections to control their blood sugar levels. It is becoming more common for people with diabetes to take a combination of oral medication and insulin injections to control blood sugar levels. Diabetes medications. Many different types of medications are available to help lower blood sugar level in people with type 2 diabetes. Each type works in a different way. It is very common to combine two or more types to get the best effect with fewest side effects. Sulfonylureas. These drugs stimulate the pancreas to make more insulin. Biguanides. These agents decrease the amount of glucose produced by the liver. Alpha glucosidase inhibitors. These agents slow absorption of the starches a person eats. This slows down glucose production. Thiazolidinediones. These agents increase sensitivity to insulin. Meglitinides. These agents stimulate the pancreas to make more insulin. Diphenylalanine derivatives. These agents stimulate the pancreas to produce more insulin more quickly. Amylin synthetic derivatives. Amylin is a naturally occurring hormone secreted by the pancreas along with insulin. Incretin mimetics. Incretin mimetics promote insulin secretion by the pancreas and mimics other blood sugar level lowering actions that naturally occur in the body. Insulins. Synthetic human insulin is now the only type of insulin available in the United States. It is less likely to cause allergic reaction than animal-derived varieties of insulin used in the past. Examples of rapid-acting insulins. Regular insulin, Humulin R or Novolin R, insulin Lispro, insulin Glulicin, prompt insulin Zinc. Examples of intermediate-acting insulins. Isofen insulin, neutral protamine hagidrone, insulin Zinc. Examples of long-lasting insulins. Extended insulin Zinc insulin, insulin glargine, insulin detimir.